we should not be stigmatizing members of communities. We live in communities where we all should be caring for each other and watching out for each other. And no matter what the issue is, there are other infectious diseases that affect other communities or other health problems that affect the elderly or particular race and ethnicity or particular people who are immigrants from other countries, or all sorts of things we deal with in healthcare that while everybody could have it in that moment, it happens to be in that community. And so I think the danger is that people begin to get stigmatized. And I think it does for those of us who remember this or have been able to read about it. Some of the stigma we saw around HIV, right? I'm an HIV physician. I care for HIV patients. HIV cuts across all race, ethnicity, sexual orientations, ages. I think people need to remember that, and I think this has the potential to do the same thing. So we are saying where is the issue right now? What parts of our community need the support and the preventative therapies and the vaccinations and the tests and the treatment? It happens to be in the gay community right now. But as I mentioned, we already are aware of cases that have spread outside the gay community that had nothing to do with sexual activity. And so we want to put our limited resources where they need to be used because we want to make sure this doesn't spread any further than it already has. But as I mentioned, we should not be stigmatizing groups because of this. We should be supporting them and making sure that our community members get the care that they need.